Mission to serve. The Mother Teresa of Mau in the dusty, poverty-stricken district of Mau in eastern Uttar Pradesh. There is a hospital that has become synonymous with healing and hope. At its heart is a woman who treats her profession not as a career, but as a divine calling. Known affectionately as the Mother Teresa of Mau, Kerala-born Dr. Jude of the Medical Sisters of St. Joseph has devoted more than 3 decades of her life to the service of the sick and the poor. To her, medicine is not merely science, but a mission God's work in action. Over the course of her career, the soft-spoken yet indefatigable doctor has performed more than 70,000 Caesarean operations. A staggering figure that speaks not just of skill but of relentless dedication. On one extraordinary day, she even attended 382 outdoor patients, a feat few doctors in the world can claim. Yet, when asked, she humbly brushes it aside as nothing more than doing God's work. A journey to Mau. Dr. Jude's journey to Mau was not meant to be permanent. In the late 1970s, she was working at Fatima Hospital in Uttar Pradesh, when the Christian missionary-run Fatima dispensary in Mau desperately needed a gynecologist. The dispensary started in 1977 by 3 sisters of the Medical Sisters of St. Joseph. Was overwhelmed by female patients but had no specialist to attend to them. The nearest government hospital was nearly 40 kilometers away, and every day desperate women were being turned away. So in 1979, Dr. Jude was sent to Mau for what was supposed to be a temporary 3-month posting. But faith had other plans. Her presence immediately transformed the dispensary. Patients poured in, and soon 3 months turned into 6, then 9. Eventually, she never returned to Pilipit. Instead, she made Mau her permanent home in Fatima Dispensary, which began as a modest room surrounded by jungles, grew into a 250-bed Fatima Hospital with over 150 staff members under her watch. As Sister Roselet, the Mother Superior and one of the founders of the hospital, recalls. Without sleep or rest, she worked day and night, never saying no to any patient. There appeared a divine passion that seemed to be guiding her, for no human being could have so much energy or stamina. The calling of a lifetime. Dr. Jude's story begins far away, in Kerala. From a young age, she nurtured a desire to dedicate herself to a holy life. At just 17, she left home to serve God, joining the convent with the intention of becoming a nun. But destiny guided her path differently. In 1975, the convent sent her to Lady Hardinge Medical College in New Delhi to study medicine. There, she discovered a deeper dimension to her calling. Medicine could itself be a sacred mission. As she later reflected, "I wanted to become a saint. I became a doctor instead. But I soon realized I was doing God's work." Her medical degree became not just a qualification, but a spiritual mandate, a way of living her faith through healing. Struggles in the early days. The MO that welcomed Dr. Jude in the late 1970s was harsh and unforgiving. The area was poverty-stricken, literacy was low, and medical facilities were nearly non-existent. The dispensary itself had little funding, bare facilities, and was surrounded by jungles. Theft and dacoities were common. Patients often arrived in dire conditions after traveling long distances. Their situations worsened by delay and lack of prior medical care. One such case, still remembered in Mau, came on a scorching May afternoon in 1979. The pregnant wife of a contractor from Balia arrived at Fatima Hospital after a grueling 40 kilometers journey. She had a ruptured uterus and was on the brink of death. Dr. Jude performed life-saving surgery and managed to save her life. Word of her miraculous intervention spread rapidly, and from then on, patients from far and wide began to flock to Fatima Hospital. Women with ruptured uteruses, heavy bleeding, placenta problems, and obstructed labor began to seek her treatment. For years, she worked without an assistant, without rest, and without a break, relying solely on her faith and grit. A tireless healer even today, at the age of 67, Dr. Jude lives virtually in the labor room. She is available 24/7, rarely taking time off for rest or meals. Her daily schedule has been so rigorous that the sisters of the convent had to intervene to ensure she received at least 5 hours of sleep a day. Initially, she would attend to hundreds of outpatients in the morning and then perform surgeries late into the night. In recent years, a system has been introduced: one day for OPD, the next for surgery. Even then, she sees around 200 patients per day, though sometimes she insists on treating extra cases because she says, "I cannot refuse anyone who needs me." Her only break from this relentless service is a short annual trip to Kerala to visit family. Even then, she keeps her vacations to just a week. "I get restless and bored after a week. I miss my patients. Mo is home to me now," she confesses with a smile. The most challenging cases over the decades, Dr. Jude has handled some of the most difficult medical cases imaginable. She recalls 4 cases, in particular, that tested her skill and courage, to breech deliveries and to surgeries where the attending doctors elsewhere had accidentally severed the baby's heads. In one case, the baby's head had been left at home and I had to send for it to stitch it back on the body. In the second, it was brought along with the patient. In both cases, we could save the mothers. She recounts with calm matter-of-factness. She has also performed deliveries on HIV-positive pregnant women cases that are usually referred to specialized centers. But Fatima Hospital, under her guidance, has a policy of never turning away an HIV-positive patient in distress. With meticulous precautions, double gloves, antiseptic solutions, and isolation, she proceeds without fear. "I am not afraid," she says simply. A life of simplicity and service. Despite her unparalleled service, Dr. Jude has never sought wealth or recognition. Once, when a journalist suggested she must be drawing a hefty salary after working at Fatima for over 3 decades, she laughed and replied, "Why should I be paid a big salary? The hospital looks after all my needs, food and clothes. What more do I need?" Her humility is as striking as her medical feats. To her, Mo is not a remote, forgotten corner of India, but the very center of her universe. She has never complained about the hardships of her posting, nor has she expressed regret for not pursuing a more comfortable life in metropolitan India or abroad. Beyond medicine, a gardener's joy amidst her grueling schedule, Dr. Jude still finds time for one other passion: gardening. She takes great pride in growing vegetables, especially papayas, which have become famous in Mo as Dr. Jude's papayas. She carefully collects their seeds, stores them in bottles, and distributes them as gifts. For her, gardening is not just relaxation, but another form of nurturing life. The Saint Doctor of Mo, for those who meet her, Dr. Jude is more than a doctor, she is a living saint. Patients and colleagues alike describe her as a woman of extraordinary humility, compassion, and discipline. Her clear eyes radiate sincerity, and her words are filled with quiet conviction. When asked if she has any regrets, she smiles. "Regrets? No, none. I am very, very happy. I am doing God's work." Her work gains even greater significance when seen against the backdrop of India's maternal health crisis. According to UNICEF's State of the World's Children report, more than 78,000 women die each year in India due to complications related to pregnancy and childbirth. In such a context, the role of dedicated doctors like Jude becomes all the more vital. Legacy and lessons. Dr. Jude's story is more than just a biography, is a lesson in what it means to live a life of service. In an era when healthcare is often commercialized and access to quality treatment remains limited for the poor, she embodies an alternative model. Medicine as a mission, not a market. Her life challenges us to rethink the meaning of success. Is it measured in wealth, recognition, or professional accolades? Or is it measured in lives touched, tears dried, and suffering alleviated? By those standards, Dr. Jude has already achieved sainthood. Conclusion: for over 32 years, Fatima Hospital in Mo has been more than a medical institution. It has been a sanctuary of hope for the poor and the suffering. And at the center of it all stands Dr. Jude, the tireless healer who gave up comfort, ambition, and worldly rewards to embrace a life of selfless service. She is proof that one person's dedication can transform an entire community. For the women of Mo and the countless lives she has saved, she is not just a doctor, but a savior. India could do with many more like her. But until then, in a small town in eastern Uttar Pradesh, the Mother Teresa of Mau continues her mission, day after day, surgery after surgery, life after life, quietly, humbly, and with an unwavering belief that she is doing God's work.